Some people want it all, but I don't want nothing at all. If it ain't you, baby, if I ain't got you, baby. Some people want diamond rings, and some guys want everything, but
Good day everyone, I'm John David Osolis. I'm 24 years old and I'm currently a 6th-year dental student at the University of the Philippines College of Dentistry, and I am also a singer. So as a future healthcare professional and performer on stage, it's important to look and feel your best. Kaya dito sa CSA Medical Aesthetics, as a long-time patient, I've always felt na this is the right place to have your medical aesthetic needs done. So una po naming nalaman ng CSA Medical Aesthetics sa cable. The first patient actually was my mom, then became my sister and I. So talagang ramdam po namin yung alaga ni Doktora, and ever since 2019, we've been active patients po of her. Don't forget to click the like, share, and subscribe to keep yourself updated.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a new guest. Let's all welcome. I should call him Dr. soon to be David Solis.
Hello po.
Welcome. Batang-bata pa si Doc. Single and available. O, di ba? Yan, he's just 24 po. 24, okay. So, like I did an assessment on David a while ago. Actually, I was doing when you check on the upper third, Doc, yan, yung forehead. We check on lines, wrinkles. The youngest that I had, like a wrinkle on the forehead, 18 years old, Doc. And aging starts at 25. Yan. And because you're so studious, lack of sleep, it can lead to the development of lines and wrinkles on the forehead area. So horizontal lines, vertical lines, glabella area. And then also we check on the eyebrow, we check on temple, we check on the eyelids also. Yan. Laging puyat si Doc dahil sa kanyang pagpupursigi sa kanyang pag-aaral. Oh, yeah. So upper third, I'm already noticing this forehead lines here. Like it's common nowadays. I see young males having deep creases on the forehead, okay? It could be genetics, it could be the lifestyle, the lack of sleep, stress-induced. Most of the time, stress-induced, okay? Now, looking at the middle third of the face, okay, we have the so-called, like, the cheek area, we check the so-called curve or projection of the cheeks. Actually, cheek curve ni Doc pang baby. Para na siya, ano pa siya, category ng newborn, neonatal cheeks, okay? So, we have these fat pads on our cheek areas, okay? And it's normal that you see a projection there because of these fat tissues also, okay? So, si under eye naman, Doc, puyat, yan. We also check on the under eye, we see some tear trough already. And a beginning Indian line or Indian band here in the middle of the malar areas, okay? So the cheek area, so far, there's good volume, there's good projection. Actually, we wanna make a masculinized mid-face or cheek area. Okay ba yun, Doc? Yes, okay yun. So for men, actually, on the profile view, medyo lang, Doc, ng konti, parang neutral. Neutral yung projection ng cheek area. Okay? And then nose region, the center of the face, center of attraction. Ayan. So we can also do like a bit of an elevation of the radix and also improving the nasolabial angle. A masculinized nose. Yan, baby nose pa rin si Doc. Yan. Because Asian nose, we know, round shape, right? We have a short, round, like medyo flat sa dorsum or the bridge of the nose, okay? So we want to improve that. And going on the lower third, ayan, medyo, yan, fat volume also, Doc. Yan. Sabi ko sa'yo, Doc, baby ka pa eh. Neonate din. Sabi mo nga kanina, yun. So we have some fat tissues here also on the lower third of the face, okay? And then, like a while ago, I did a palpation of the mandible angle, and I noticed, or like upon palpation, there's the so-called hypoplastic mandible. Mandibular hypoplasia, Doc. It's common among Filipinos, among Asians, na we have this like deficiency of this angle of the mandible. Like most of the patients I have assessed, if I palpate the angle, it's kind of inwards or deficient also. So we want to bring that out, especially for men, di ba? You want the masculine jawline, defined jawline, chiseled jawline, ano ba tawag doon? Snatch. Angular, yan. Ano, sila Brad Pitt tuloy, Brad Pitt, okay? So we kind of like, they're the example of having this good masculine jawline there, okay? And ayun, creating also yung parang dito, laxity of the under the chin. So we also want to improve the chin area, improve the jawline there, masculinize the face, harmonize the face. There you go. Balance everything, equal ratios and proportions to achieve that ideal, aesthetically favorable, pleasing face. Lahat na. Okay? So we're excited. Ating abangan sa pagbabalik ng CSA Medical Aesthetics. And we're back. So we're with soon-to-be Dr. John David Solis. Okay, so ayan, Doc. A while ago, we discussed about the mid-face section here and on this part of the lower face. Okay, so I'll start working with this area. I'll use my Ultherapy. Okay, so we know Ultherapy is making use of ultrasonic energy, and we can target some of our fat pads here. I'll start working on this side here. Doc, one shot lang ha. How's that? Yeah, okay. So, actually, before doing Ulthera, you can apply topical numbing cream in the area that you will work on. You can leave it for about like 30 minutes to 45 minutes or even an hour just to numb the area, okay? So, there's a normal sensation of like a pricking sensation, right? And some heat sensation. So, we also need some like a certain temperature. Like they were saying, like around 50 degrees Celsius temperature to induce a so-called like fat coagulation. So we want to reduce some of the fat pads there. Okay pa tayo, Doc? Yeah. So I can start delivering, like for example, this area here, I can deliver like a 30 shots. I'm using the 4.5 millimeter, and in the 4.5, you're reaching the SMAS layer. You want to target also the fat tissue, reduce the fats. Okay, so I'm on the 4.5, and you can check on your screen there. So there's an imaging. That's a good thing with Ulthera. You can visualize the tissue layers you are targeting. And I'm on the 4.5, and I'll be giving like around 30 shots for this area. Okay. Then after that, I'll move with the lower third part. So as to the number of the shots, it will depend. You can do your customized treatment for your patient. It should be an individualized treatment. Okay. So there are like protocols you follow here, but it's best to do individualized approach because it's not like we have the same kind of face. No, Doc. Yeah. So personalize your treatment. So I'm gonna deliver my last 2 shots in this cheek area. Then I'm also gonna apply shots on the lower third of the face here. Okay. So you wanna do jawline definition. You can also make use of your Ulthera device. So for men kasi, ano bang ideal shape ng lalaki? Square, di ba, Doc? Ayan. Sa aming babae, meron kaming V contour or inverted triangle. Or actually, oval shape. For men, square shape. So your zygomatic width and bigonial width should be balanced. Okay. So, we're working on mid-face and lower face. So, pwede pa tayong mag-work sa upper third ni Doc kasi meron siyang mga, ayan Doc, meron ng lines, wrinkles. And then, on the mid-face center, the nose area, I'll be doing nose enhancement, non-surgical. We just want to create a good projection of that nose, right, Doc? Something that's within your ratios and proportions. The angles of the nose. So it should really balance the face shape and the kinds of structure you have. And we are not altering the anatomy of your face. We just want to enhance and highlight those attractive features of your face. Yon. Paano maging attractive? No, Doc? The attractive features of the face. Actually, in different parts of the world, they have different like standards for beauty. Would you believe in Europe, I gave a talk and they're asking me to teach them how to make their face round. And I told them in Asia, they want the face not round because we're already round shape, okay? So the Ultera will take effect like in weeks time. So it's not an instant, it's gradual. So for now, I'll be working on the center of the face, the nose. Yan, ang magandang nose namin. So Asian nose, we're really known to have this kind of low radix, low bridge, short length, and kind of wider and round shape, right? So we just wanna like improve, enhance, follow the angles, okay? I'll numb the entry point here. So doc, ano lang to, lidocaine. Marunong ka ring mag-lidocaine inject. I'll be injecting in the entry point here, just a tiny prick here, inhale, exhale lang po. And then after that, we'll use our introducer needle. The introducer needle could be gauge 18, gauge 19. So this is just lidocaine lang to numb the entry point. Yan. Taas ang tolerance ni doc. Then we're gonna insert into this entry point. Okay. So yeah, I can do my lidocaine solution. So this is a 2% solution. Actually, I'm using a cannula. Okay, OS please. And then glide it through that entry point and then pass through the so-called layer 4. Okay, so this is just a 2% solution just to numb the entire length of the nose, and so that Doc John will not feel any discomfort. Okay, and it's also like a hydro dissection already, creating a space, a tunnel, or yun, layer where we want to place our product. So I'll be using our absorbable PDO threads to enhance the nose. Okay, so I'm gonna reach the radix part there. So this is just a 2% solution just to numb the entire tissue area. Okay, and we can start with our long PDO. And we use the gauge 21. Gauge 21. Okay, so I can use, because ang nose mo, doc, is already good naman eh. Maganda na yung height, so we're just enhancing. So I'm on my second PDO thread for the bridge. And then I'll be on the third. Was able to anesthetize the area. And the fourth. We'll be using up to 6. So I'm doing my last 2. Then after that, we'll do the tip projection. Then for the nasal tip, I'll be using a short PDO thread. So I'm using the same entry point for this one. I'm just gonna direct it in the columella space or intercrural space, and I have my 2% again. So this is with cannula, gauge 22. Direct it into the space there. Okay. Some resistance. Okay. Then just anesthetize the area, 2% solution up to the anterior nasal spine. Doc, medyo normal lang, like heaviness and pressure on the upper part of the inner oral mucosa there. Okay. Then just 1 and 2. Now I'll be working on the lower third of the face. Okay, I'll work on the chin area. So for the chin, we want, for masculine type, is a square chin. Okay. So for that, I'll be using my filler. So for this part, okay, usually if you want to improve your the male chin, if you want to improve a male chin, okay, we want a square type. Okay, now the vertical length from the corner of the mouth to the mandibular line, and same on the opposite side, corner of the mouth to the mandibular line, that should be like an area where you want to place filler here on the mandibular border. So if you want to lengthen, and if you want to also project the chin, you can also place on the anterior part here. Okay, I want to use a cannula, so we'll do the cannula method for the chin projection. Cannula, please. Okay. So I'll make an entry point here. Like, you can use the vertical line you made from your corner of the mouth to your mandibular line, and you can actually just deliver your product like in the labiomentalis sulcus and onto the center of your menton there. Okay, just delivering like that. So I can use half here. and then deliver onto the menton there to have an anterior projection. So male chin, female chin, we vary, okay? So women wants rounded and tapered and narrower chin, but for male chin we want squarish type, longer and wider for men. So now I'll deliver the other half of this on the mandibular border there. I'll make an entry point inferior to that mandibular border there. Okay, just a tiny prick. Okay. So I'm working on the chin. Now, as to the number of the fillers, it will depend. Usually for masculine chin, depending also on how receded and how short the chin is, there are cases I use 4 syringes of this, or it could range from 2 syringes to 4 syringes, depending on the need. Okay, you just glide this in the mandibular border, okay, inferior part there, and like a retrograde technique, you just deliver it there. Now the plane should be a subdermal plane. You don't want to like go on the periosteal layer because you have some vessels there. So you want to use the subcutaneous area here, subcutaneous plane. There is just some resistance because if patients had history of, for example, acne, especially men have acne mandibular area, okay, so I expect some resistance there. But the plane should be just the so-called subdermal plane or layer 2. Okay, you're still good, doc? So we want to improve the length of the mandible here. So for like measurements, you can use your Ricketts E-line and your like the lower, dividing the lower third of the face into 1/3 and 2/3. You can follow that kind of measurement too. Okay. Again, for men, masculine shape, masculine jawline, masculine chin, squarish, wider, broader, and kind of really robust, no, doc? Yan. Because men are really muscular. Okay, so we'll proceed to the chin, from the chin to the mandible angle. There you go. We'll proceed to the jawline area. Okay, I'll be working on the angle of the mandible since we have hypoplastic mandible there. So you can work on the angle of the mandible, palpate for this part here, and then we work on the anterior aspect of the mandible, just a prick there. Okay, there's already the bone. Aspirate. Okay. If you know you are in the correct layer, okay, and you're avoiding those facial artery branches, like your facial artery comes out from your mandibular notch here, so the facial artery is here, I'm avoiding that. So I'm just gonna do my bolus injection here, a macro bolus, like a 1/2 ml. You can even use up to 1 ml of your product here. Then I'll do a so-called like L-shaped pattern for the mandible here. I'll use the same filler. I'll make an entry point on that angle of the mandible there, puncture 1. Disinfect please. And then make a puncture there, make a letter L shape. Okay, using my cannula again there, so expect some pinpoint bleed. So you can also direct it towards the earlobe, inferior portion of your earlobe, okay? So you have a cannula here, it's a gauge 22 cannula, and you can make a retrograde technique here, or you can even make a semi-fanning technique at this part here. So we can add some more product please. So we want to create a good angle of the mandible for Dr. John here. Another product. So as to the number of syringes, again, it will depend on how hypoplastic the mandible is. So there are cases that we use like per side 2 syringes. So we're gonna follow the line of the mandible here. So for the case of Dr. John, we'll still add threads to create that L-shaped mandible, okay? So we're already doing prejuvenation for Dr. John David. So don't wait that you become older before you do something. Prevention is better, right? So we call this prejuvenate. You prejuvenate. Don't wait. Don't rejuvenate. Just prejuvenate. Okay, I make a linear retrograde here. You can use like a 1/2 syringe in this part. So I'm in this subcutaneous plane. Don't go on the deep plane because you have your facial artery vessel on the deep plane there. So some series of retrograde techniques there using 0.5. You can reach up to the pre-gel sulcus if you can, if you have a longer cannula. Okay, but don't add any more in the jowl area actually. You don't want to create heaviness there. Okay, so my final part for this one, I'll use my PDO threads to create further a stronger, a robust jawline there. So I'm just gonna be injecting like a tumescent anesthesia here for my threads there. Okay, so this is gonna be my entry point for my thread, same entry point. I'm just gonna actually the filler already has lidocaine, so I can go direct to that. So I'm using a 90mm PDO cog thread here, just direct it in that line there. So again, go to the sub-Q plane or the layer 2, okay, just to create that good jawline there. Then I'll use a 60mm cog thread, same entry point, and it's an L-shaped pattern here. For some doctors who are doing reinsertion method, you can actually reinsert the part of the thread that's not inserted. You can also do that. Okay, I'm just gonna direct it in the layer 2 up there. And there you go. So we've done the right side, cut the part here, and we'll proceed to the left side of his face. We have done combination procedures for David here, and it's going to cut off this main and the thread. We pull this out when CSA medical service returns. And we're back, so let's show the result to Doc JD. I actually call him JD. John David. Yun, JD, short for John David. Yan! JD, kamusta?
Ganda, doktora.
Yan. We brought out the angle of the mandible. So our goal is to have that jawline definition as well as that chin enhancement and also that nose projection. Plus also we want the mid face and the lower face to be in harmony with the full face. Yan, Doc John David, JD. May instant result, right?
Opo. And
Yeah.
masasabi ko lang, Doc is really an artist.
Importante yon.
Pinagsamang physician and artist. It's both a science and an art.
Art, yeah.
And sobrang galing po ni Doktora. You see na, it's still me.
Still you.
But dati napapansin ko po na merong facial asymmetry and Doktora corrected it as you see. So this procedure is really recommended for those who still want to be themselves and
Right.
just want to boost their confidence. For me, I want to feel better on stage and I want to feel conscious. So Doktora helped me
Correct.
so much.
Yan yung tinatawag na scientific art. So we're both in the medical field. So we understand na it's not just like, injecting the face or doing these kinds of procedures, but making you look natural plus handsome in your age. Yan. And still recognizable. And yun nga, highlighting the attractive features of the face. Actually, very attractive na si JD eh. So, in-emphasize lang natin, in-enhance lang natin. We just brought it out and we made everything within that balance and symmetry. Because, aesthetic beauty or aesthetic attractiveness is within that ratios and proportions, balance and symmetry. Harmonious lang. Balance lang lahat. Yan. Next time, i-botox natin yung upper third para walang lines on your wrinkles. But for men, parang acceptable na may konting creases on the forehead. But for women, it's a no-no na may wrinkles on the forehead. Yan. Ano lang yan eh, it speaks of your being industrious in your studies. There you go. So I can see an instant result, a natural result. So we brought out that angle of the mandible and we made also the chin like, you know, within that square shape. Plus the nose, we enhance it naturally. It's not overdoing it. And then for the Ulthera effect, we still have to wait like 4 weeks, 8 weeks, 12 weeks to see that kind of like just a neutral, you know, projection on the mid-face and also on the lower face. And yan, harmonious na lahat. I'm so happy for you.
I'm so happy, Dr.
Yan. Parang kanina neonatal, ngayon ano na, adolescent. Yan, yung talagang we made the shape of the face within that, yung age mo talaga na 24. So happy for you, JD. Thank you so much for being with us. Okay. Yeah. Meron ka bang social media if they want to follow you? Yan.
You can follow me on TikTok, John David Solis. I post dental content and a few covers, a few song covers. So.
Yeah, we will follow you and follow us also at our Instagram, CSA Medical Aesthetics, Facebook, CSA Medical Aesthetics. If you have any questions, you may email us at csaskinclinic@yahoo.com. Our clinic is located here at the Infinity Shop, Pulong Maragol, Angeles City. Our contact number 0933-860-9193 or 091750444268. And let's watch future episodes ni JD. Siyempre, may follow-up yan. We will still kind of improve further, okay? So, our YouTube channel, Contessa Salvador. And thank you so much for subscribing, for following us, okay? So, when it comes to natural beauty, you can trust the CSA Medical Aesthetics.